So if I'm right here in the process of sensory integration and things aren't coming together well for me, I can go over here and then make a correction, okay, to my motor planning here. Now, if I get here to the motor command and something isn't feeling right, I can go back again to this reference of correctness and fix it. Unfortunately, most of our kids with developmental disabilities, or many of them, maybe not most, but many that I've worked with, they don't get feedback until it's production feedback right here. So they don't get feedback till they get the movement. So if they knock over the cup or they jam it into their mouth or whatever they do, they're frustrated by that. So I think by understanding this model and giving our kids lots of different experiences with cups, for example, and whatever we're teaching them, we get something called generalization so that they can effectively function within their environments. Now we've covered some basic anatomy and physiology. Let's talk in this slide about facial characteristics seen in newborns, children, and adults. The measurements we are discussing came from the work of Char-Bochart. So in the newborn, child, and adult, the first thing we should see in all of them is the horizontal width across the eye area of the face should be approximately the width of one eye times 5. So in the drawing Anthony's father did here of Anthony, here's Anthony's eye width, and we should see that width 5 times across the face. 1, 2, 3, 4, 5. And we see the same thing in the baby. Here's the eye width, and then even though we can't see this side, 1, 2, 3, 4, 5. This means that the hard palate is in good shape and developing well. Let's talk about drooling management. In my experience, this is a 4-part process. We need to look at upper airway concerns, oral sensory concerns, jaw concerns, and swallowing concerns. At the picture here of Carmen, who is 21 months, this is way too much wetness on her nice little dress for somebody 21 months. We also see with her that she's narrow across the eye area. She looks very immature in terms of mid-face development, and she was a mouth breather. By 24 months, we should remember see no more drooling or dribbling because most of the teeth have come in, and we should never see profuse drooling like this. This is also how you help a child move their gag back toward the back of the mouth. Remember, by 6 months of age, a child's gag should be on the back 1/3, and for an adult, it should be on the back 1/4, so close to that. So if you're working with an infant and they don't have teeth and won't bite you, you can work on cupping and grooving this way. This is called tongue walking. Remember, tongue humping and bunching is never normal. Then as a child gets older, we not only want to work on grooving the tongue, but we also want to give stimulation all over the tongue because you'll either learn, or we've already talked about the fact that not only does the tongue cup and groove, but these sides of the tongue seal along here for the swallow and for speech sounds like T, D, and N. You'll learn that later in the course. So we want to give the tongue a really good brushing. So we want grooving. And we want to brush here, and a lot of times I will roll my brush and come out the lateral and inferior borders of the tongue. So we work our way back, and many times I'll just roll my brush and come out the lateral inferior borders and inferior borders of the tongue. We can place the bite block straight in, so I keep mine in a tray, an ice cube tray. I've got 2 sets. When I do my jaw work with my chewy tubes or I do my bite block work, I do it with the child. And I have the parents do the work with the child. With the bite block, you place it straight into the back molar area, you put a little tug on it, and guess what this one is the jaw height for? E. Okay? Then the jaw drops down, bite down, hold, I. Jaw drops down. A. Jaw drops down. Eh. Eh and eh, by the way, are the hardest vowels to get. Jaw drops down even more. Ah. And if you email me, I will send you the vowel chart with the bite blocks and the jaw closure tubes.